a podcast by respiratory leaders for respiratory leaders. This is RT Sidebar. Stay tuned.
All right, Barfly Nation, welcome back to RT Sidebar, the podcast for respiratory therapy. I am the Matty P, and I was able to record this episode with one of RT Barfly's best friends, Mindy Conklin, APRT extraordinaire. She was our first guest host. She did a great interview with Sarah to understand about how APRT came to fruition. It was a fantastic time at the Ohio Society for Respiratory Care. So I just want to say thank you to Mindy. Listen to the episode. You're going to see some nice clips. I hope you enjoy. This is RT Sidebar. Stay tuned. So, Mindy, you're our guest host today.
Yeah.
Why don't you introduce us to our special guests?
I have from the Ohio State University.
Very good.
So I have Sarah Veracogis here. She is the clinical director at the Ohio State University undergrad program for respiratory therapy and for the advanced practice respiratory therapy program that is currently ongoing. Welcome, Sarah.
Thank you. Thank you. Excited to be here.
So Sarah, our first question for you is, how did this get started? How did the journey to develop a master's in respiratory therapy program get started?
Yeah, absolutely. So I will say that a huge part of the credit for the advanced practice respiratory therapy program at the Ohio State University goes to our advisory committee. So every co-arc accredited program is required to have an advisory committee that has representatives from the communities of interest, right, for each program. And so at one of our advisory committee meetings for our undergraduate entry to practice program, probably back in 2007, believe it or not, we were talking about our program outcomes and had shared some information about graduates that were continuing their education to become advanced practice providers, to go to medical school, all of those kinds of things. And the hiring managers at the table were like, yeah, we seem to be losing our best and brightest. And the physicians at the table were like, yeah, but we love them. We want them. We want more of them. And so kind of the conversation started about, is there a place for advanced practice respiratory therapy? So the faculty then took that from the advisory committee and started to really, well, could we make this happen? Could this really be something that would be a reality eventually? So we started with a needs assessment, local throughout Ohio, medical directors, physicians, pulmonary and critical care physicians, especially, as well as the education programs. We also did surveyed graduates of baccalaureate entry to practice programs across the country and said, well, is there a need? And so the overwhelming response to that was yes. So the students said, if you build it, we will come. And the physician said, please build it. So we started to look at what would curriculum look like. And at the time that we published our needs assessment in 2014, and right around that time, COARC had received some information about kind of developing a curriculum process that they went through with Society of Critical Care Medicine about an advanced practice respiratory therapist. At the time, they were kind of considering it a pulmonary PA. And so, so we kind of tried to marry those two things together, and what would accreditation standards look like and what would a curriculum look like. And so COARC actually published their accreditation standards first, which was great for us as the education program because it kind of gave us a little bit of a roadmap. And then we looked around at what are our resources and what courses already existed at the university. At the Ohio State University, advanced practice education is for nurse practitioners. We don't have a physician associate program. And so we looked at what courses they offer that might pair well with the advanced practice respiratory therapy needs, curricular needs. And so we enjoy an excellent relationship with the College of Nursing Leadership through our undergraduate program. We do a lot of interprofessional simulation and education with them. And so we approached their leadership and said, would you give us some seats in some of your advanced practice nursing courses? And they said, of course. We really did not receive any resistance from the College of Nursing. That surprises some people. But they recognize that this was a niche, right? And just like some of the niches that they offer in their education programs. And so they were more than willing. So that was, one big hurdle. And then another was starting to have conversations about clinicals. So there are no APRTs to provide the clinical precepting, clinical instructing. So we were going to have to rely on physicians to be the preceptors or the clinical instructors. And so there was a lot of conversation that had to occur about would the physicians support the clinical education of another learner, right? A different type of learner beyond the medical student, the resident, the fellow, what they're kind of used to. And then there was also a lot of conversation at our partner clinical organizations about making sure that everybody understood we weren't trying to step on anybody's toes. We weren't trying to kind of take the place of any nurse practitioners or physician associates that are already working, at the medical center or at Nationwide Children's. And so lots of conversations with them. The physicians actually were excellent in facilitating those conversations so that they kind of knew where everybody's place was and those kinds of things. And then we also had conversation with hospital administration at both of our partner organizations about, would you eventually employ these individuals? We don't really want to graduate people that are unlikely to be hired, right? That doesn't make a lot of sense.
So I have a couple questions.
Yeah, for sure.
So today, Mindy, during your lecture, because you talked to the whole, state society today, which was awesome. Loved it. You had a story when you went into, I think it was your pathway dance class, and you were 7 of you guys and 220.
120 nurses were in this class.
So how did that feel? Like, Sarah, you're like, all right, go do
Right.
it. And
That's
then you're just like, holy crap, I'm walking in, like, how that?
Yeah, so it was kind of overwhelming because it's a big auditorium. You walk in and there's nurses from every age, like 20s, maybe just out of high school that were going into the entry to NP program. So when we walked in, we're sitting there, we look around and it's full of these nurses who, a lot of them that we work with there at Ohio State. So they were aware that we were coming into the program, that we were taking the same courses that they were. So a lot of them were very, very supportive.
And again, we partner. So while the faculty teach in the program, we also partner with a lot of physicians to do a lot of instruction.
So it's a lot of facilitation.
So
A lot.
yeah, so
A lot.
we had a lot of the physicians that we work with that were eventually our clinical preceptor
Correct.
in our clinicals
Okay.
come in to talk about sepsis and how we treat it, cardiac diseases and disorders and ECMO and how to manage that. Just a variety of things that go above that of an RRT and that the nurses probably learn in their curriculum, to become nurse practitioners, whether they're acute care or family medicine.
I think that's so smart because you're going into a new frontier.
Right.
So if you just wanted, hey, I'm an RT and we'll figure this out, like you wouldn't have been successful if you needed to bring it to party.
Yeah, and I will also say, so we use our physician partners, but we also recruited a third faculty member for this advanced practice respiratory therapy program. She is a graduate of the Ohio State University undergraduate untreated practice program, and she continued her education and became a nurse practitioner. She actually works for pulmonary critical care and sleep at the medical center as a sleep nurse practitioner. So we recruited her. We actually negotiated. So we borrow and maybe pay for about 40% of her time. And so she then as an instructor in the program as well, because she obviously has that specialty area and she can talk about kind of making the transition from being an RRT to being an APRT to being an advanced practice provider and helps to also kind of fill in some of those gaps with about how do you need to write your notes so that it can get reimbursed? And what do you need to do when you're coordinating with the DME company? And all of those kinds of things as well. So she fills in a lot.
So she was our professor for our advanced assessment class.
Yes.
Which, that taught us how to write our note properly.
Yep.
Their differential diagnosis, our assessment and plan. But she was also the one that taught us how to do a total body, full body assessment.
That's right.
Because to be an advanced practice provider, you just can't go in and do a cardiopulmonary assessment.
No.
You have to be able to,
From here to
correct.
there,
That's right.
so you have to be
That's
able to palpate the stomach, listen to the stomach. If your patient hasn't went to the bathroom for several days in the ICU, what are you going to do?
Right.
You have to be able to give them a bowel regimen so they can go to the bathroom.
Yeah, so you need to know that, and then you also
Yeah.
need to know how do you manage their sepsis, right? I mean,
Correct.
like, this is a head to toe. An advanced practice provider is a head to toe role, right?
100%.
Absolutely.
Even though we specialize in cardiopulmonary, that's our niche. We have to know how to manage that patient, like
Right.
she said, head to toe. Because if they're in my ICU at the VA and they're there for sepsis, I need to know why they're septic. How do I treat it? If it's an infection, what's the source and what antibiotic do I start?
Right.
So, here at the OSRC, it sounds like we might have our first shout out. We're talking about somebody, we're going to give a shout out.
Yeah, let's give a big shout.
Shout out to Jessica Schweller.
Schweller.
Yep.
Yeah, Jessica's amazing.
She is amazing.
And she is very pro APRT. And I think that if APRT was here when she went through grad school, she would have definitely be an APRT right now.
No shade to Mindy, but we do consider Jess our first APRT. Even though she's a nurse practitioner.
There are a lot of
She very
RPs
much-
who are advanced practice providers, whether they're physician associates or they're nurse practitioners. Some go back on to be anesthesia assistants,
That's right.
some go into CRNA.
Right.
So there's
They-
different pathways, but now, the Ohio State has created this program so we can stay respiratory therapists and practice at that next level. So I have to give a big shout out to Sarah, to George, for helping develop a program that has started basically a new profession for me and eventually here soon. Fingers crossed, legislation. We'll talk here in a
Right,
second.
that's right.
For the other 14 graduates who have graduated from the MRT program there at Ohio State University.
Right.
I have to say the.
I just,
Yeah, yeah.
All right, Barflies, I hope you enjoyed our friend Mindy talking to Sarah about APRT. My deepest apologies, though, to all the Barflies out there. Turns out I'm a respiratory therapist, not a podcaster, and I mess up the audio, and I really apologize. The story behind the story today was really the friends from Ohio State. See, it's not just Sarah or George or Ryan Bellamy or anybody. It was a collection of everybody that really wanted to see Mindy succeed. The magic in the episode that was lost was everybody that came up to talk. Andrea, everybody, all the other APRTs walk up and say, hey, you know what? We did this together. We wanted to see APRT. And more importantly, we want to see Mindy successful. And when you talk to Mindy and when when I talk to her, because I enjoy her so much, and I'm going to see her soon back in Pennsylvania where we can record some more. But when I think of that, I think of, all the people that supported her, all the people that continue to support her in the profession, getting licensure, getting legislative approval, getting jobs, opening up things at the VA. There's so much that went into it. And Mindy is probably the most gracious and grateful person I've ever met. And she really highlighted all of her friends, all of her family at the Ohio State that made her successful. So unfortunately, I missed that story, but I want to tell every barfly out there, Mindy's story matters. Your RT family matters. They want to see you successful. We all have an RT family. And those RT family want to see you successful. And you can't be a great respiratory therapist or an APRT or an advanced provider. You can't do any of that without the support of your family. So big shout out to the Ohio State and everybody involved with her success. Thank you for paving the way. Thank you, Ohio Society for Respiratory Care, for having us. Thank you, Mindy. I can't wait to see you soon. Have a great end of your summer. Get these kids back in school. That's where they belong. I hope you enjoyed RT Sidebar. I will try not to screw it up next time. So be well and stay tuned. Ohio State friends, that I will eat a Buckeye. Here we go. That's pretty good. All right, I get it. That's pretty good.
Vapotherm does not practice medicine or provide medical services or advice. Any clinical recommendations provided herein are solely those of the speaker. Practitioners should refer to the full indications for use and operating instructions of any products referenced before use. Pelvichco and Hayes are employees of Vapotherm. Butler is a paid consultant, and our guest is not compensated.